Provider notifications. You may remember during Lab's last survey by JCAHO, which is their accrediting body, we were cited on a lack of ability to track reporting of critical lab values. Part of our corrective action plan was to redefine this reporting. Our survey window is opened up for HVAP to begin their triennial survey process. The first thing they'll follow up on are corrective action items cited by other regulatory entities. Collaboratively, we have developed a process to assist all departments in the collection of this critical data and comprehensive documentation of reporting efforts. So what's changed? Lab will continue to call the nurse with critical lab values. Their time frame for reporting is 30 minutes after the specimen is resulted. In order to facilitate tracking of the specimens, each tube is assigned a specific barcode number. Remember, each tube is specific to a battery of testing. Some of the most common tubes are the lavender top, which we collect CBCs, hemoglobin A1C, and a SED rate, amongst other testing. The green tube, or green top, which contains most chemistries, or troponin Is. We collect drug levels and pregnancy tests in a red top tube. And we collect most coagulation studies in a blue top tube. Lab will call the nurse and report the critical value and the specimen barcode number of the reported tube. They will request that the critical values and specimen barcode be reported back to them, just like the provider telephone order process, to ensure the accuracy of their reporting. The lab will also ask for the nurse's first and last name in order to complete their needed documentation. The nurse will then be required to report the information to the provider within 30 minutes of receiving the information from lab. The provider must also read back the critical value to ensure that they have heard the value correctly. Our total time for reporting critical values should be under 1 hour. As a secondary level of security, the nurse will be documenting the reported critical lab as well as the specimen barcode on the revised provider notification intervention. Being sensitive to the fact that you're not always in front of the computer to perform this documentation when it's reported, a provider notification form was developed for you to collect the data in the moment when the critical lab is called. This form should be returned to a centralized collection area specified by your unit leader. I'll refer back to this later. Keep in mind that critical lab values coming from different tubes may be reported at different times. Please do not delay reporting beyond the 1 hour total time frame while waiting on another test to result. Let's take a look at the provider notification form. First, you have essential demographic data to assist with both tracking and documentation. Next, you'll notice dedicated areas to record both the critical lab value and the specimen barcode. Keep in mind, if your critical values are from different tubes, you'll have different specimen barcode numbers. Next, you'll be able to record and track the time you paged the provider and the time the provider responded. For your convenience, there's a place to record the provider name, just in case it's different from the attending, and how many attempts were made to contact the provider. All of these things must be included in your documentation in Meditech. Now let's take a look at some changes made to the provider notification intervention. These are pretty self-explanatory, but there are some things worth pointing out. First, you'll note the reasons for notification are more robust, and many situations are included that were not addressed before. Moving down the intervention, the reason the practitioner was not notified have also been expanded. This would include selections like reporting for patients on an insulin drip in the critical care unit. Specialized protocols were developed regarding treatment of these patients, including nursing actions for values that would report as critical with a patient in DKA. Please ask for clarification on which critical values the physician would like reported during specialized treatments. You can see there are other selections, again, that cover a variety of situations where you wouldn't necessarily, through order or otherwise, report this information. If there are any instances where you'd like to write a comment regarding reporting, a comment field is provided for you. To document the critical value and its designated specimen barcode, please select specimen 1, 2, or 3. These selections will be collapsed until you open them for your required documentation. As indicated before, the provider notification critical values form should be returned to an area designated by your leader after you complete your documentation. This will allow us to evaluate the process in real time for both compliance and documentation, and the need for additional education for both our employees and our providers. Once we become accustomed to the process, we'll continue to utilize the forms if they're helpful to you. Thank you for your dedication to protecting and defending those who entrust their care to us.